Breathing movements, upper ribs, they are involved in pump handle movements. Here sternum moves anteriorly and posteriorly, therefore antero-posterior diameter of thorax increases. Lower ribs, they are involved in bucket handle movements. Upper ribs, pump handle movements. Lower ribs, bucket handle movements. The lower ribs, therefore, transverse diameter of thorax increases. Upper ribs, antero-posterior diameter of thorax increases. Lower ribs, transverse diameter of thorax increases. Muscles of inspiration. Chief muscles of inspiration is diaphragm. During inspiration, the diaphragm descends down and vertical diameter of lung increases. Therefore, more air can be pulled inside the lungs. Forceful inspiration. Other muscles can also be used along with the diaphragm, like the external intercostal muscles, scalene muscles, and anterior intercondral muscular part of internal intercostal muscle. External intercostal muscles, scalene muscles, anterior intercondral muscular part of internal intercostal muscles. Muscles of expiration. Expiration is mostly due to elastic recoil of lung, which pushes the air out. Forceful expiration can be done with the help of external oblique muscle, internal oblique muscle, transverse abdominis muscle, lateral fibers of internal intercostal muscles. Aspiration in pleural effusion. Aspiration in case of pleural effusion is done at scapular line or axillary line. It is always given above the rib border. This is because if it is given below the rib, vein, artery, nerve from up to down structures may get damaged. Aspiration is done at scapular line or at axillary line. Structures passed from outside to inside during aspiration for treatment of pleural effusion. Serratus anterior, external intercostal muscle, internal intercostal muscle, innermost intercostal muscle, endothoracic fascia fused with parietal pleura. Serratus anterior muscle takes origin from upper 8 ribs. During aspiration, do not puncture the visceral pleura, as then the lung will be punctured and this causes hydropneumothorax. Intercostal nerve block. It is given in case of multiple fractures of ribs. For this, anesthesia is injected both below and above the rib. This is done to block the intercostal nerve and collateral branches of neurovascular bundles. If collaterals are not blocked, pain will persist. Important information regarding intercostal nerve block. We risk the damaging the collateral neurovascular bundle during aspiration by pushing the needle at upper border, but main neurovascular bundle is safe because main neurovascular bundle is at lower border of rib. Apex of lung. Apex of lung is covered by cervical pleura and then covered by suprapleural membrane. Suprapleural membrane. It's the modification, degenerated tendon of scalenus minimus muscle. It is also known as Simpson's fascia. It attaches to inner border of first rib and transverse process of C7 vertebra. It separates subclavian vessels from apex of lung. Posterior aspect of first rib. Structures sandwiched between the posterior aspect of first rib and apex of lung anteriorly, medial to lateral. They are sympathetic chain, first intercostal vein, superior intercostal artery, ventral rami of T1 spinal nerve. Structures running on superior surface of first rib, subclavian vein, tendon of scalenus anterior muscle, subclavian artery, scalenus medius muscle insertion, lower trunk of brachial plexus. Highest oxygen concentration in fetal circulation is at which site? It is at inferior vena cava. Structures arranged from anterior to posterior relations at a lung hilum are anterior to posterior. That is pulmonary vein, pulmonary artery, and bronchus.